Hello, my name is Jim Toot, and I'm an Associate Professor of Political Science at Central Virginia Community College. In this video, we'll discuss healthcare policy. Medicare. In 1965, the most extensive healthcare coverage legislation in American history became law. Medicare helped citizens 65 and older meet their primary medical care needs. It covers around 40 million people. Medicare has two parts. Part A pays for some of the hospital charges for individuals who are eligible for Social Security benefits. It is funded by payroll deductions and matching contributions from a patient's employer. People are responsible for both a deductible charge that must be paid before Medicare payments are authorized and co-payments for many hospital-related services. There are no limits on the total costs people can incur. Part B is an optional insurance system covering healthcare costs outside of hospital stays for physician services, medical tests, and outpatient visits. Participants pay a monthly fee, deductible charges, and co-payments. The government contributes about 3/4 of the overall costs. Medicare's lack of a prescription drug benefit was particularly hard on elderly and disabled, who commonly take several prescription drugs. Responding to this need, the Medicare Prescription Drug and Modernization Act of 2003 contains two types of assistance programs. The first is a prescription drug discount card program saving Social Security recipients roughly 15 to 25% annually. Medicaid was created in 1965. It provides health care coverage for approximately 50 million poor and disabled Americans. More than a third of them are over 65. The federal government pays about half the cost of their medical care, including hospital stays, physicians' fees, and various diagnostic services. States pay the remainder of the cost of the coverage. In addition, the federal government requires coverage of the blind, the disabled, and children under the age of 18 whose family's income is below the poverty level. Otherwise, states decide eligibility for inclusion in Medicaid. State standards vary significantly. Some eligible in California might be excluded in Texas. Around 51 million Americans lack health insurance. This figure included approximately 9 million under the age of 18 who were eligible for but not enrolled in Medicaid or the Children's Health Insurance Program. Some 28 million people came from households with income above the poverty line, but whose employers did not provide them with health insurance. Their work was often temporary or part-time and low paid. About 15 million of the uninsured had income below the poverty line, yet were not receiving Medicaid. In March 2010, the Democratic majority in Congress passed the Patient Protection and Affordable Care Act, arguably the most important domestic legislation in decades. It passed without a single Republican vote, and despite millions of dollars of advertising aimed at the 40 Democrats in the House deemed vulnerable to defeat if they voted for the bill. In this instance, party loyalty, appeals from party leaders, especially the president, advertisements from supporters of the legislation, and the realization that it was the most propitious opportunity to enact health care reform in many years overcame the opponents' arguments in advertising.